Number 19, we're gonna make a crown. Then designated in administration, we can see our pre-op. We had a very large filling in that tooth. So instead of waiting for it to break, patient elected to protect with a crown design right now. So here's our prep. Isn't that pretty? Pretty severe wear and tear in the front. We've talked about a night guard. Really, he's got some crossbite in the anterior, which is the reason for that wear. So ortho would have been helpful when he was younger. All right, strong margin. May come back and touch up that buccal margin. I want to see what our proposal looks like. We had a bit of an abfraction there. So just use that as part of his chamfer. So we may come back to that.
Okay. I think he speaks a little bit of English,
Okay.
but should I ask him, like, should I get on the translator or just,
As far as like the perio goes,
yeah, or ask him
um,
if anything's bothering him?
yeah, I would ask him if he's having any pain or if he has any concerns. If he doesn't have any pain or concerns, I would just go ahead and do the perio maintenance. And when I come in and do the exam, I'm going to talk to him about that periodontitis.
Okay.
Does that make sense? Clear as mud. Yeah.
Like this.
And if he's got pain or any concerns before you start, just come get me and I'll come talk to him.
All right.
All right.
So you just type in Google Translate.
Google Translate English to Spanish. Or you could ask him, Tienes dolor.
No.
Do you have pain? Okay.
Okay.
Yeah,
I'll forget that right when I walk out.
What did he say?
And then I'll
Yeah,
say
yeah,
something,
yeah.
like terribly. Like,
Yeah, dos
offensive.
cervezas, por
Yeah.
favor. He'll be like, wait a minute.
All right.
Yeah, try that.
So 3-5.
Yeah, 3-5. Yeah. Got it. All right. Got a tight contact here, so we're gonna keep that in mind when we're designing this proximal height. Spacer 120 microns. All right, so we got good design started. Let's put on our opposing model to adjust that hyperocclusion. Good. Check his pulled tooth. Yep, it's gonna work. All right, see his proximal contact. Now I know that he's a little tight here, so we're gonna have a little bit of green with a lot of double turquoise. Just enough green to pop that floss, feel warm and fuzzy inside. Not so much that we can't get this crown on. Good. Good. Tissue contact, not really worried about that, but smooth just a touch. Check our contour. Do we like this? It's not bad. I'd rather that green be in the middle of the contact. Too much. Come on. There we go. That looks better. Let's see this distal one. It's gonna be good. Again, this tissue contact, I'm not really worried about it, but I'll smooth it just a touch. Just a skosh. Look at that nice, smooth internal line angle there. All right, so all of this is looking good. Let's turn on our articulator and see what happens when his jaw moves around. This new tool, upper functionally generated path, no interferences. That's great. Check for our pre-op. Looking very similar. Should be a perfect fit. Contour, all this is beautiful. I may round these line angles just a touch. There we go. Now in business. All right, we made a crown. Have a great day. Thank you for watching.